Okay, we're going to do the knee exam next. So just going to point out some important locations in the knee anatomy. So we can see here on the anterior knee, we can see the outline of the patient's patella. Sometimes it can be difficult to figure out where the patella is on the patient. And when that's the case, I like to put my hand where I think it's going to be and move the leg through flexion and extension, which helps me to feel that border of the patella a little bit better. We can palpate from here. You can palpate along the patellar tendon, the quad tendon. We can also palpate the joint line, which is where the meniscus sits. So we can palpate here along the lateral joint line where the femur comes down and meets the tibia, and then also same spot but medially along the medial joint line. The other thing that you can do from this position is you can find your location where you would do a palpation knee joint injection. So I would feel the lateral border of the patella, the lateral border of the patellar tendon, and the top of the tibia into this soft spot, which is where I would put the needle in at to get the medicine into the knee joint. And we'll also have a video that shows that in more depth later on. So we've inspected the knee, we've palpated the knee, so now we can do some range of motion. So we'll have our patient lay back on the table. With the knee, it's pretty easy. We can flex and extend. So she can flex her knee up back towards her or bend it up towards her, and then also extend it totally straight. You could do some strength testing there also. If you wanted to check if the patient's able to activate their quad muscle, you could do a resisted straight leg raise. You could have the patient roll over onto their stomach and check that the opposite way also if we needed to. We have some special tests that we're going to go through for the knee joint. We're going to start with a test for our ACL or the Lachman's test. So this can be a difficult test to perform, so we'll talk about it, but then it's important to practice this one a lot. So to check for the ACL, I'm going to put my top hand in the form of a C on the patient's femur and my bottom hand in another C on the patient's tibia. So if you look at this leg, I have a hand here and a hand up top here. So then if I'm going to perform this test, we do the test at 30 degrees of flexion. So I'm going to bring the patient up to 30 degrees, and then I'm going to start my test. So I always keep them here, bring them up to 30 degrees, and then I'm providing an anterior force on the tibia while I provide a posterior force on the femur. And you can see her tibia moving anteriorly when we do that. This is a negative Lachman's exam because she doesn't have a ton of laxity where we can see that tibia really move a lot off of her femur. So that's for our ACL. We have another test for the ACL that we'll talk about also. This one's called the anterior drawer. For this, we're going to have the patient's knee bent to 90 degrees. Like to stabilize their foot by sitting on it, and then you're going to pull the tibia anteriorly towards you. We can also test the PCL from this position, doing a posterior drawer by pushing posteriorly on the tibia. So here we're going to do a valgus and a varus stress test to test our MCL and our LCL. So our MCL running here along the inside of the knee and LCL on the outside part of the knee. So I'm going to put the heel of my hand on the outside part of the knee for the valgus stress test. My other hand is going to be here on the ankle, and I'm going to apply that valgus force through the inside part of the knee. And then we would switch and do the opposite for the varus stress test. Again, heel of the hand, but this time I'm on the inside of the knee, applying a varus force through that outside part of the knee. The final test that we're going to do is for patellofemoral pain syndrome. For this, we're going to do the quad inhibition test. So the patient's going to lay both of their legs flat. We'll do it on this knee. And a few important things here. We can see that if the patient flexes their quad muscle, that it pulls the kneecap superiorly. So you can see that moving towards her head. So what we're trying to do is create friction here at the kneecap. And I'm going to do that by holding the kneecap down with my hand and having the patient flex their knee again. So you can see that it's trying to move superiorly, but I'm providing friction here. So if the patient has pain with this test, it's a positive test. For our ligament test, if the patient has laxity or looseness that's going to be a positive test for those.